I started Inliant after more than 11 years in this field because after interacting with clinicians and deans and students and educators worldwide, I realized that there's tremendous potential in helping people and providing people with the treatment that they need.
Essentially, we found out the kinds of things that were barriers or challenges to adopting this kind of product. We solved all of those, and we went from there to build the software. That essentially gives us a very strong feeling that we are doing what people want rather than simply presenting a product that we think is the best.
The Inliant system is built around the concept of dynamic surgical guidance, starting with the patient's CT data, then incorporated into live, real-time feedback for the clinician on the screen.
Real-time surgical navigation solutions exist, but none of them integrate seamlessly into the clinic the way that Inliant does.
It's very minimally invasive in terms of the amount of space it occupies. The changes, particularly to the system that the dentist is used to using, are very minimal.
We're working with the world-class leading handpiece manufacturers, incorporating markers onto the handpiece, hence there are no mechanical attachments. The biggest advantage is that we're not changing the ergonomics of the product.
We use cameras to measure the handpiece and the patient. No contact with the patient, we don't interfere with the patient, and we can make accurate measurements from a distance.
They're attached to the existing operatory light, and by so eliminating the need for any added cuts in an already crowded environment.
It's designed to answer all the needs of the clinician in terms of surgical workflow and the clinic workflow to introduce some efficiencies for the clinic on one hand and to provide the best patient outcome on the other.
The handpiece is unchanged. It's a very small attachment to the patient. There are no wires, there's no calibration, there's no alignment, there's no special procedures. So the surgeon is free to work as they would before, completely unencumbered, unhindered, and don't really have to know that we're there.
So it was very important for us to keep the software as clean as possible, to make it very streamlined, very user-friendly, very intuitive. These are very key features from the point of view of the clinician who wants to minimize the time they spend planning, and also, once they're in surgery, ensure that that's a very streamlined process, that they're not spending a lot of time fussing around with the software.
Clinicians have shared with us that the peace of mind they get being able to see on the screen in real time what's occurring using the Inliant system has been a huge benefit.
Our focus is on providing the best customer service. We know that our customers expect us to look after them, and to us, our customers' needs are most important.
Being in the medical device industry, we are absolutely committed to meeting quality standards, safety standards, and regulatory requirements to meet our #1 goal, which is to have safe and effective products for dentists to be able to use on their patients. We have a very rigorous quality management system in place, which is already certified to recognized international standards for quality management systems, ISO 9001 and ISO 13485.
The same way that cone beam CT transformed dental surgery, Inliant will do the same.